From Kern Government Television, welcome to this week's Kern County Board of Supervisors meeting, originating from the County Administrative Center located at 1115 Truxtun Avenue, Bakersfield, California. Kern County's vision is to create and maintain a customer-centered county government designed to garner the confidence, support, and trust of the people we serve. Today's Kern County Board of Supervisors meeting will convene momentarily.
Okay. Ready? Okay, board to reconvene. Good morning, Madam Clerk. Would you please call the roll?
Good morning. Supervisor Gleason?
On Patriot quarantine, but I'm here.
Okay. Supervisor Scribner?
Here.
Supervisor Maggard?
Here.
Supervisor Couch?
Here.
Supervisor Perez?
Here. Thank you, and welcome to the Tuesday, March 17, 2020 meeting of the Board of Supervisors. We will begin today's meeting with the flag salute led by our very own Supervisor Mick Gleason. Following the flag salute, please remain standing for a moment of prayer, silence, or meditation, whichever you prefer.
Please join me to salute the flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. We will not have a Pet of the Week presentation by Kern County Animal Services today for the obvious reasons. We want to thank our Animal Services Department for the work they continue to do, especially during these uniquely complex times. Agendas for today's meetings are located at the tables at the back of the chamber for anyone wishing to follow along. We will begin by considering the consent agenda. All items listed with a capital C, capital A above the agenda item are considered to be routine and non-controversial by county staff. Consent items will be considered first and may be approved by one motion. If a member of the audience wishes to comment or ask questions regarding an item or items on the consent agenda, they may do so prior to a vote being taken on the consent agenda. A member of the board may remove an item from consent and it will be considered in its listed sequence with an opportunity for any member of the public to address the board concerning the item before action is taken. A member of the public may also comment on any closed session item. Consent matters begin on page 2, and they include items 3 and items 6 through 8. On page 3, items 9 through 11 and 15 through 17 are on consent. Item 14 has been withdrawn by the department. On page 4, items 18 through 25. On page 5, items 26 through 33. On page 6, item 34 is on consent. Items 35 and 36 have both been withdrawn by the department. Are there any members of the public who would like to comment on any matters on consent? Okay, seeing none, we'll return to the board for question, comment, or action. I understand, Supervisor Gleason, that you do have a recusal as to 4 items.
Yes, ma'am. Number 9, number 10, number 11, and 27. I'll be recusing myself because of my wife's employment.
Okay, we will. I will ask the motion maker to consider that modification.
Motion with those modifications.
Second.
Thank you, supervisors. We have a motion, a second. Please cast your vote.
The motion is approved. All ayes.
Okay, moving right along to resolutions and proclamations. Number 1 is a resolution honoring Christopher Borner, I hope I said that right, Department of Human Services, good, upon his retirement with 36 years of dedicated service to the County of Kern. 36. Outstanding. I understand Supervisor Couch will be making this presentation. And number 2, which is a resolution honoring Rebecca Rojas, Department of Human Services also, upon her retirement with 29 years of dedicated service to the County of Kern. 29 years.
So motion on items 1 and 2.
Second.
Thank you, Supervisor. We have a motion and a second. Please cast your votes.
The motion is approved. All ayes.
We're practicing our social distancing today, but we'd normally give Dina a hug and shake Mr. Border's hand, but we'll we'll wait to another day for that. But we're here to honor him. By the way, happy St. Patrick's Day, everyone. Probably not the best day to celebrate that, but thought I'd mention it anyway. We're here today to honor and commend Christopher Borner upon his retirement with 36 years of dedicated service to Kern County. I'm going to read the proclamation, the proclamation, and I'm going to turn it over to Dina and let her say a few words. She's been the department head for several years now, while Christopher's been there 36 years. He began his career on March 1st, 1984 in the Department of Human Services as an eligibility worker in the Aid to Families with Dependent Children program. In August of 1984, he transferred to the foster care unit. On October 24th, 1987, he promoted to Social Services 1 and was assigned to the In-Home Supportive Services and Adult Protective Services cases in the Taft office. He was promoted to Social Service Worker 2 on June 17th, 1989. And in January of 1990, he transferred to the Greater Avenues for Independence program, also known as the GAIN program, as an Employment Services Social Service Worker and returned to the Bakersfield office in August of 1991. He promoted to Social Service Worker 2 on October 6, 2001, a position he held until retirement. He worked in specialized areas during his tenure with Employment Services, most notably the Quality Assurance and Federal Work Participation Rate Review. He also volunteered for many projects such as the Case Management Pilot Program, Kern Works Job Fairs, and served as a board member of the West Kern Counseling Center Adult Advisory Council. Mr. Borner's supervisors consistently evaluated him as a tirelessly dedicated, accurate, dependable, cooperative, knowledgeable, quick to volunteer, and decided asset to Kern County. He was an exemplary employee whose hard work, commitment, dedication, and loyalty to the department earned him the respect and the admiration of both peers and colleagues. His many contributions to the Department of Human Services will be missed, and he is wished the absolute best in all of his future endeavors. Now, therefore, be it resolved that the Board of Supervisors of the County of Kern, State of California, does hereby honor and commend Christopher Borner upon his retirement with 36 years of dedicated service to the County of Kern. And I have a proclamation here for you, Mr. Borner. I'm going to leave it here. It's signed by all the members of the Board of Supervisors. It's dated today, March 17th, 2020. But I'll invite Dina Murphy up to say a few words. Thank you.
Thank you so much, Supervisor Couch, members of the board. I'm Dina. I'm the department head for Human Services. The first day that I came to work for Kern County Department of Human Services, I met Chris Borner. He had started a few years before I did, but he actually even was one of the people that I sat with to receive some training. I don't know if he remembers that or not, but back in Employment Services in Gain, like 26 years ago. So we go back all the way to the beginning of my career for sure. Some fun facts about Chris, his first family home was purchased from the Sears and Roebuck catalog and built on site and still stands today, and his mom still lives there. And it's a darling little home. You have to look it up on Google. He's been kind enough to show us. And Chris was born in Germany and spent just a little bit of time there as a child and then grew up in Indiana. And then we got him here in Kern County. This was his first post-college job where he met Stacy and married her. And actually, our daughters were born a month apart. So when I say we started together, we kind of grew up together. One of the things when I gave Chris at the director's coin, I said I so admired about him was his dedication. He is retiring as a social worker 3. And he earned every advancement that he got. He's meticulous with his work, always caring for others in the community and taking care of making sure that they got what they needed and that they were safe. But I appreciate come rain or shine, Chris was on the bus making the transfers and didn't miss work. I mean, he just was always there to care for others. And certainly we had a big party when he left, and we hope someday to sneak him back in as extra help, because I'll tell you, he's meticulous about finding trends and things that make us better workers. But for Chris, I won't miss you because you're not going to go away. I'm looking at you up on the screen. I can't touch you because of social distancing, but I can look at you. And we enjoyed great camaraderie when we would do silent auctions at work to earn money for really good things like dollars to go towards children having driver's education where there was a gap in funding with the agency. So we didn't have money to do that, but we could do silent auctions and we could earn money as staff and then make sure the kids got what they needed. But Chris was always competing with me, and he crushed me more than once, just crushed me, and with great delight, and he just laughed about that. So Chris, I'll miss you, but we hope to have you back with us someday, and I'd like you to have the opportunity to say a few words, and then also, I know your wife and daughter are in the audience, and perhaps have them stand and introduce them.
Thank you very much. I'd like to thank the Board of Supervisors for this proclamation, as well as you, Dina, and all the people back in the office that have worked so hard on putting this together. I'd like to thank my wife, Stacy, and my daughter, Kelly, for coming. And I just wish that everyone from the department could have been here, but under the circumstances, we're doing the best we can. And I've appreciated working for the county for all my 36 years. Thank you.
Well, fabulous. Thank you, Chris. Hey, Chris, I have a question. Where in Indiana are you from?
I grew up in Bloomington, Indiana.
Oh, I went to law school at Valparaiso. I absolutely fell in love with the Midwest. It was very much like Bakersfield, Valpo. Felt very much like home.
Maybe Valpo, but not in Bloomington.
Well, you know, a fellow Hoosier, a wannabe Hoosier to a real one. Congrats, and thank you for your devotion to Kern County.
Thank you.
Okay, thank you, sir.
Okay, well, Rebecca only has 29 years of service with the county of Kern. But congratulations, Rebecca. It's my honor today to present this resolution also for Rebecca Rojas upon her retirement with 29 years of dedicated service to the county of Kern. And I'll read what it says and again turn it over to Dina Murphy. Rebecca Rojas began her career at the Department of Human Services on November 6, 1990 as a social service worker 1. On November 16, 1991, she promoted to social service worker 2 and then to social service worker 3 on April 2, 1994. Pretty quickly. Ms. Rojas worked in nearly every program of child welfare, including family reunification, court review, emergency response, permanent placement, adoptions, resource family approval, and the A. Miriam Jamison Children's Center. In 1995, Ms. Rojas was instrumental in the implementation and ongoing success of the Emergency Foster Home Program. The program aimed to immediately place children ages 0 to 5 in foster homes as opposed to a stay at the Jamison Children's Center. During Ms. Rojas' time in this assignment, she enhanced the well-being of countless children. The Emergency Foster Home Program continues to be an integral practice of the Department of Human Services 25 years after its implementation. In the final years of her employment, she has been an effective member of the Resource Family Approval. She's worked diligently to ensure the resource families she approved provided a safe and healthy environment and quality parenting to the foster children placed in those families. And throughout her career, she has been an exemplary employee who provided quality work with an inspiring work ethic. Her many contributions to the Department of Human Services will be sorely missed, and she has wished all the best in her future endeavors. Now, therefore, be it resolved that the Board of Supervisors of the County of Kern, State of California, does hereby honor and commend Rebecca Rojas upon her retirement with 29 years of dedicated service to the County of Kern. It's adopted today, March 17th, 2020, signed by all the members of the Board of Supervisors. So, Dina?
So just to be fair, Rebecca had 7 years of work experience with LA County before coming to Kern County. So she actually has had 36 years, not Chris, it's a tie, 36 years of really having a servant's heart and taking care of the children. It was significant what was said, the procedure that was put in place 25 years ago to make sure that the little ones coming through the door weren't going into a shelter setting, but were going into a home setting, and Rebecca was responsible for that. But she's also a very special woman, a woman of faith, and a woman who's hung on to some of the children that she's touched in their placements and in their lives and continued to visit with them. She's hung on to some medically fragile children for a lifetime. I know she's very close to 2 young men that are brothers, aged 12 and 18 now, that were placed at birth. And I told her, you don't ever have to let them go. You've been in their life for all these years, and they're part hers. And so she will continue to hang on to those little boys and breathe life into them. And when I say breathe life into him, they didn't expect the 12-year-old to live. He was placed and expected to be terminal. And she sees these children on an ongoing basis, and she makes it possible for these 2 little brothers to visit with one another. They cry when they part. The 18-year-old is a special needs child as well, but is in college at Bakersfield College. But, you know, to give your heart and soul over, you know, to not compartmentalize, to never let go of the little human lives that you're making a difference in every single day, is just a very blessed person with gifts that they have shared abundantly with the children who, through no fault of their own, come into the Department of Human Services. And her lovely husband, Frank, has supported her in her endeavors for all the extra work and time that she spent at the department, because you don't just walk away from a child in the middle of something, and quite often that means you've got your own time, your own family time invested in making lives better for those little ones. So I just am very proud of Rebecca, and we'll miss her, but again, you know, she'll be another one we'll try to steal back. It just is how we are. We can't really ever let them go, and I think they can't really ever let us go because we're such a big extended family, because what we do is from the heart, and there's a passion for it. But with all the sincerity, I say to Rebecca that we are going to miss you. I know that we'll continue to touch and pass the cross, because I know that you're an antique buff and you have a vintage little shop downtown, and I love antiques. Wow. So we will continue to cross paths. But thank you for your 36 years of county service in total, even though only a minor 29 were here. Thank you for what you've done for Kern County, and especially for the vulnerable children that you've served.
I'd like to thank the Board of Supervisors and the Department of Human Services for acknowledging my years of service. It has always been my career choice to serve the children and families of Kern County with respect to social work, and it has been my pleasure. I have to thank my husband, Frank, because there were countless days and evenings when I had to say that I would be late. And he just said, okay, just let me know when you're coming home. So thank you, Frank. And to everyone, I will miss working for the department, and I would love to come back as extra help. Just don't ever forget the foster kids of Kern County, because it's a hard little road. I take many, many stories with me right here, and will continue to advocate as long as I'm able to. Thank you.
It really is a testament to your values and your faith that you remain so soft-hearted after so many years. It really is just wonderful and refreshing to see. So thank you for loving the children of Kern County.
I really don't. I have a flip phone. I just got this phone. I don't know anything about it. Sorry. I don't know how.
I was going to say, somebody help him, but now?
I hope it works. Sorry, everyone.
Yeah.
Is it working?
Yeah.
Your picture?
Yeah, take a picture.
Okay. All right. Thank you. I love it.
Okay, well, thank you very much, Supervisor Couch, for both of those resolutions. We're going to move right along in the agenda here. Actually, I do have to exercise Chairman's prerogative. Madam Clerk, if I may propose to my colleagues the non-agenda item under CAO of 17.A. This is a motion to consider a non-agenda item, number 17A. Make the finding that we need to take action on non-agenda matter occurred after the agenda was posted because the coronavirus, COVID-19, continues to spread rapidly, resulting in the need for the county to be able to quickly and without delay respond appropriately to public needs and employment matters. Although there are no reported cases of COVID-19 in Kern County, there are increasing numbers in the state of California, including neighboring counties. Due to the quickly evolving situation related to the coronavirus within the county, state, and country, the need to proclaim a local emergency was not known until after the agenda was posted. That is the legal justification to consider and to ask for a motion from my colleagues to consider item number 17A. Gentlemen, I need your help.
You want a motion?
Thank you.
We got it.
Supervisor Gleason.
A second.
We have a motion and a second. Please cast your votes.
The motion is approved. All ayes.
Thank you, Madam Clerk. Item 17A, proposed resolution ratifying proclamation declaring local state of emergency regarding COVID-19. Approved, adopt resolution, authorize chairman, county administrative officer, and director of emergency services to take all reasonable steps to obtain state and/or federal assistance. I'm going to turn now to our CAO, Ryan Alsep. Thank you for your leadership and swift action on this matter. The floor is yours, Ryan.
Yeah, thank you, Madam Chairman, Chairwoman, members of the board. At this time, I'd like to invite our Director of Public Health, Matt Constantine, to the podium to provide some remarks on the status of the pandemic here in Kern County.
Good morning.
Good morning, Madam Chair. Just a very brief overview. In the United States, as of March 15th, there's always a couple-day delay. There's been 3,536 cases of COVID-19 identified, with 68 deaths in 49 states. In California, as of March 15th at 6 p.m., we've identified 335 cases with 6 deaths, and a number of counties within the state have identified ongoing community transmission. That is a significant component as we watch the disease progress through the United States. In Kern County, we have 30 return travelers that the CDC has provided names for us to monitor. 22 of those 30 have either not needed monitoring or have completed their 14-day monitoring period. The remainder are still within that monitoring period, and we stay in daily contact to look for early signs of the disease. We also have 84 notifications of tests that are being conducted, COVID-19 tests. 36 of those so far are negative, and the remainder are also pending. This morning at 4 o'clock this morning, we were notified that a non-resident, while visiting Kern County, has tested positive for COVID-19. This will not be counted as a case, as this person is a visitor and resides outside of Kern County, but we wanted to make sure we provided you the most up-to-date information.
Where's the visitor now? Here in Kern or has left Kern?
At this point, I think I'm going to suggest we not discuss details about the case, Madam Chair, if that's possible.
Yes, it is.
We are still investigating what occurred, and we'll ensure that we do everything possible to protect the community. Lots has changed as you've been seeing what's happening on the national level and at the state level. We've had a lot of information about what to do with mass gatherings or community events. Initially, we've been asking those that have greater than 250 in attendance to postpone or cancel those events. As you've seen, that has changed yet again. The recommendation last night from the governor was to postpone or cancel any gathering at all. For restaurants and bars, there's been a lot in the media also since this weekend. Initially, we were asked to request that bars close down and restaurants reduce their occupancy in half. As of last night, that has changed again, and they're asking that all in-dining eating not be allowed, and it would be takeout or delivery only. We've also met with most of the churches in Kern County last week and asked them to suspend further services until we have clearance from the state. We've met with nursing homes and retirement homes to go through the current guidance from the state to limit transmission. In those facilities, they've asked that no more than 10 people congregate at one time. Yesterday, we met with most of the city managers in our incorporated cities to ensure they have the most up-to-date information and to offer resources that we have available. We have also, this weekend, been asked to further recommend that anybody over the age of 65 self-isolate in their home to further prevent transmission. And as of last night, we were also told that there's going to be some request for local gyms to not operate. That has not been in writing yet, but that was mentioned last night. There's been a lot of interest in testing, and there's been a lot of confusion on testing. So you understand, for when you go into a doctor and you have symptoms that may be consistent with COVID-19, a doctor is able to make that determination, and the doctor is able, in either the doctor's office or in any other healthcare facility, to take a sample. It's usually a nasal or throat sample, and they put that sample in a test tube and they send it to their contracted lab. As of last Monday, not this Monday, but last Monday, commercial labs can now start testing for COVID-19. There is no shortage or no backlog in testing. Omni is testing. They're actually setting up drive-throughs. They have all their clinics available. We have priority urgent care and accelerated urgent care that are setting up drive-throughs and tents. We have the hospitals that are able and are actively testing and sending their samples on. Most of the tests are turned around somewhere between 24 and 72 hours. So it is a readily available test, and it is got a pretty good turnaround time, a short turnaround time. Madam Chair and Mr. Alsop, I think that concludes my comments. If there's anything more you'd like me to cover, I'd be happy to.
How do you feel about board meetings moving forward?
I think adhering to the recommendations from the state and federal government are important. As of yesterday, I would suggest that they continue. There seems to be more interest in trying to minimize any gathering. Some of the services that we provide, this communication, this agenda is important to allow county government to proceed. The setup that we have in the auditorium certainly meets that 6-foot separation. So I am okay with those proceeding, but I think that's a determination made by you, Madam Chair, and others. But as far as a public health standpoint, I think this provides an essential service and is helpful for us to have this agenda here.
Thank you, Mr. Constantine. Are there members of the board that would like to ask him any questions at this time? Supervisor Maggard.
Thank you. Mr. Constantine, there is a persistent rumor that there are no positive test results in Kern County because Kern County is not testing. Can you address that for us so the
Yes,
public
sir.
is not afraid of that?
Supervisor Maggard, through the chair, that is not correct. So testing is occurring actively. 8 days ago, I could tell you exactly how many tests are being run, but since the state now is allowing private companies to test, and the doctor is able to make that determination themselves, we're not screening those requests, and they're actively occurring in the community now. We receive all positive test results back directly from the lab, so we have those immediately, and it's required by law to be submitted to us. So testing is actively occurring. I know there's a lot of rumors on social media. There's a lot of comments. Those are not true. We talked this morning about one non-resident case, but there are no positive Kern County cases as of today.
Thank you. And with regard to the churches, is it possible to, I don't know what the right word, to facilitate that group call or some exchange so they all know that it, you know, many of them left that meeting thinking they could meet last Sunday.
Yes, sir.
And explain to their congregations how they would land this circumstance, but that's changed now. So
Yes,
will we have that communication spread out to all the churches?
Yes, sir, will do.
Okay, very good. Thank you.
Thank you, Supervisor Maggard. Are there members of the public that would like to comment or ask questions about the presentation as just delivered? Mr. Alsop?
Thank you, Madam Chairwoman, members of the board. I had a few remarks. I want to thank the county staff, the leadership of our departments, department heads, the leadership of my team that's around me, the county counsel's office. Lots of work has been put into this over the last really week and a half. I do also want to take a moment, and it's awkward that I got to do it this way, but we will want to introduce our new Chief Operations Officer, Mr. Jim Zerfus, who has joined us. Yesterday was his first day, and so he jumped right in and rolled his sleeves up and was part of the effort. So we want to welcome Jim to the county family, and we're lucky to have him. So yesterday, as you know, my office, through powers afforded by your board to me, declared a local emergency. We did so due to the potential threat posed by the coronavirus pandemic, specifically to Kern County residents, to our own workforce, and importantly, due to the impact that this will have on our local economy. And we, as you know, put in place a directive to all departments to implement continuity of operations planning. That means that all departments are going to essential staffing plans only, beginning this morning. They will do that and carry those plans forward through at least as of today, April 14th. Obviously, that is until further notice. That is in continuity with the closure of all of our school districts across this county, with lots of children being out of school. That is an additional hardship on lots of their adult parents who are working throughout this community. All of our non-essential staff deemed so during this time are being asked to stay home. We are asking those staff to not travel and to remain available to report to work if and when called upon. And that the expectation is that they do so immediately. All of our employees of the county are disaster services workers. They are sworn, they have taken an oath to those duties, and that is the expectation. We're asking those folks to work from home. Where they're, if they're able to do so, we realize that some people have spotty internet connections. We realize that some of our employees may not have a PC, but they need to be available and they need to be active to the extent that they are checking their emails and being available to their department heads who are determining work for each of their own business areas. All of our essential staff, those deemed essential, may also be working from home. That's going to be up to our department heads. And obviously those 65 and up, those who have current, are immunocompromised in some way, compromised immune systems, they should not be included in essential staff. All of our county buildings are going to be closed through April 14th, with very few exceptions, where only the most critical and essential services will need to be continued, and residents of Kern County can find out information on those services and those closures at kerncounty.com. And we have, as you know, all canceled all non-essential indoor and outdoor special events at all county parks and facilities where a permit is required typically. As you know, last week we announced cancellation of two events of 250 or more. We have canceled all events through April 14th at all county parks and all facilities that are non-essential special events that require a permit out of an abundance of caution through April 14th until further notice. So I'm happy to answer any questions that you might have or any questions that members of the public may have, but with that, it is recommended that your board approve and adopt a resolution ratifying proclamation declaring a local emergency regarding COVID-19 and authorize the chairman, Chief Administrative Officer, and the Director of Emergency Services to take all reasonable steps to obtain state and/or federal assistance with respect to the local emergency. Thank you.
Mr. Alsop, thank you. There are members of the public that would like to weigh in on that recommendation? Okay, seeing none, we'll close the public hearing and return to the board. Gentlemen, I'm sorry, Supervisor Couch, Maggard, and then Gleason. Supervisor Couch.
I'll move the recommendation, but I have a couple of questions also of Mr. Constantine. Have there been any tests conducted by public health?
No, sir.
Okay. And how often or when will you get the first notification of the number of, will you even know the number of tests done by the private labs, or will you only know the ones that test, the number of the test positive?
So anytime a test is run, they are required to notify us. That has not been fully implemented. There seems to be some misunderstanding, and those tests that are run are not always, we're not always made aware. So I know of 84 that have been run because they have provided notification, but I will 100% know about the results because that comes directly from the lab. It's electronic.
And how often do you hear daily? Or
Oh, more than daily. For example, the result we got this morning was 4 in the morning.
Okay. So what do you, this is not your fault, I get it. Somebody is supposed to be reporting to you when they conduct a test, or a certain, how many they do.
When the doctor requests the test, yes, they are required to tell us.
And how are you going to notify the public of that? I mean, people are going to want to know that number. I do.
Sure.
So how do you plan on notifying us?
So we are in ongoing contact with all the healthcare providers. We have a bulletin that goes out to them that provides guidance. We've done that several times since this outbreak. So this will be in the new guidance document that we then send out. It then takes them to implement those changes, but we're going to emphasize the importance again.
So the numbers that you get are going to be included in that document that you send out frequently? Did I understand that right?
The numbers? No, sir. Just the request to actually submit information to us when they test.
So are you going to daily give us a number, even if it's the same number you had the prior day?
I understand. So daily we are providing media briefings that would include that data. Yes, sir.
Okay. Thank you.
Thank you, Supervisor Couch.
One last question. I had it doesn't involve public health. I had a request on my way into the meeting today about people that had plans and plan check or when they had paid fees. Who does somebody that's in that sort of a contractor that's in that sort of position, this was somebody working on a solar project, planning department is open for that sort of business, Public Works is. Mr. Alsop, can you comment on that?
Yeah, they should be. That was really the plan yesterday when this was discussed. So I will, for those people, I would refer them to our website and also to their regular contacts over at our Public Services building to inquire as to how they would do that during this time. I believe that all of that is still, that process is still in place, so folks can drop those plans off.
Thank you.
Thank you, Supervisor Couch. Supervisor Maggard.
Thank you. Mr. Constantine, first of all, I want to say thank you to you and your department. You have been doing extraordinary work, difficult times, lots and lots of long hours. I know how late at night we are talking sometimes. So please know that we appreciate you and the staff you work with. And you guys need to take care of yourselves. This is, you know, all the stuff about getting sleep and rest and all that kind of stuff. So you're very important to us. Thank you to Mr. Alsop and the CEO staff for making sure that we're, you know, looking forward to being out on the cutting edge of this thing, staying ahead of it. A couple of questions about meeting. So is it, I was brainstorming with another elected official from the city last night, and there is talk that there might be some exceptions being applied to the requirement under the Brown Act for us to meet, to us assemble in public. So can somebody walk us through what alternatives we have? Can we teleconference? Can we stream it? What are the options we have for that?
Supervisor Maggard, through the chair. Yes, the state, Governor Newsom has issued some orders that change the way that board meetings may be conducted. For instance, board members now may appear or attend telephonically without having it be at a publicly noticed location. So that has been changed. You're also, of course, free to cancel or reschedule meetings. I know that was one of the things that Mr. Alsop and I had discussed. There are ways that the members of the public are being encouraged to, rather than attend meetings such as this, to submit public comments via email. Yesterday, a special notice went out to all the agencies and people who routinely receive your agendas with a special cover page suggesting that if they want to submit public comment, they may do so via email, and those comments will be considered by your board. So there are a number of things that your board can implement.
It would seem to me that it would be prudent for us to consider the frequency of our meetings. Should we meet every other week? Should it be twice a month? I think that's worth our consideration. I'm open to those ideas. It seems to me this will likely, we should consider whether or not the presentations we made today should be the last ones for a while, so that, you know, we're not bringing the public in here. As much as we honor and celebrate their histories with us and their long work, dedication to Kern County, I don't think it's prudent to expose people to things they don't have to be exposed to. Can we conduct closed session the same telephonically? Our ability to meet and discuss the, you know, there are matters we must resolve. So is that capability the same for closed session?
Yes, I believe it is.
With regard to our staff dealing with the public, so I am anticipating in my office not to have public meetings. You know, we encourage the public to call us. We can, every time we meet with a constituent, every time we hear from a constituent, it always results in a phone call or an email. So that will remain the same. But can you make sure that there needs to be some communication so that our staff, some are more technology capable than others, that they are prepared to how to access their emails through their computer or their phone into the county site, and how to, you know, how to just manipulate all the mechanics of how we're going to get it done, so we can take care of that. So will there be employees in place at, for example, the roads department, or will there be employees in place to receive those calls, or will it be via email that we'll communicate back and forth? How will we anticipate, Mr. Alsop, that the conducting of constituent services and taking care of people's needs and worries will be facilitated?
Supervisor, through the chair, I would recommend that you handle it as you normally would. If there is a need for service to be provided to a constituent, I would send those requests to the appropriate department head.
Okay. And if we do move towards telephonic meetings or some other form of that, a joint FaceTime meeting or whatever it is we do it, how do we facilitate, what's the responsibility we have so the public still has access to what we're doing?
Supervisor Maggard, through the chair, I know that Mrs. Kraus has had numerous conversations with our KGov staff, making sure that our system is designed to allow live streaming. Ms. Kraus might be in the best position to answer that. I don't know that there is live call-in capabilities for members of the public, but there is the ability for a member of the public to submit a public comment via email that could then be considered by your board.
Okay. I think we should minimize the exposure of the public. One person has inadvertently not sat in a chair that they were supposed to. They're sitting in a chair they weren't supposed to sit in. So the social distancing is not being practiced, safely enough. So just being careful about those things. If we're going to have the public come, I think we ought to be a little more diligent than. There's great effort to have the signs out here, but one person has inadvertently, not follow that protocol this morning. Okay, I'm interested in what my colleagues have to say. Thank you. I'm sorry, Mr. Alsop, did you want to respond to me?
Yeah, if I may, Madam Chairwoman, members of the board, Supervisor Maggard, just to be clear, I would say that if you have requests to any of your offices for any county services, it's suggested that you handle those how you would normally handle those. You forward those on to the appropriate staff people, and I would probably recommend the department head in this extraordinary time to be handled. I wanted to get back to Supervisor Couch's question about planning. Permits, the Public Works and Planning, they are taking calls, they are taking emails, they are open for current applications. Building permits are open. So that should be clear, and we'll make sure that's clearly identified and stated on our website, et cetera.
Thank you, Mr. Alsop. Supervisor Maggard, are you done?
Yes.
Thank you. Supervisor Gleason.
Thanks. A couple things. Building permits. On the website, I think, we had a town hall meeting in Ridgecrest last night, and the website said that new permits for oil and gas only. So what I'm hearing you say now is building permits are going to continue to be processed. Maybe you can't answer that question today, but maybe...
That's what the planning director is telling me.
Yeah, but what was written down on the website was not that.
That may be our mistake, Supervisor, and we'll change that. But
Okay.
I'm being told by your planning director right now that permits are open.
Thank you very much. Appreciate it. I wanted to say a couple things. First of all, I wanted to thank you, Mr. Alsop, for doing an outstanding job during this whole process, galvanizing all the stuff and bringing things together and clearing the way to develop a strategy for how we're, as a county, going to respond to this threat we've got going on. So thank you very much. I appreciate your leadership on that. And I appreciate your team. And I also appreciate all the department heads for coming together and coming up with a way forward. Will this building be closed?
Yes, sir. This building will be closed to the public with some minor exceptions related to elections and some other things. Again, that's all clarified. Hopefully, it's clear on our website on lists of essential services that will be open during this time.
So M Street?
M Street is generally closed to the public with the exception of, however, they're coordinating over there to receive permits, plans, et cetera.
So the decision to close, whether or not to close the Vets building, the Vet Services building, will be made by you or will be made by the Veterans Department head? Mr. Josh.
All of those decisions were made yesterday in collaboration with all of our department heads.
Okay, so those decisions are made and those buildings are closed?
Yes, sir. You're asking me if off the top of my head, I don't remember if Veteran Services is closed. I'm assuming that it is.
Yeah.
Most, if not, the vast majority of county buildings are closed to the public with very, very few exceptions, which are outlined on kerncounty.com.
Right, thank you. I wasn't trying to put you on the spot. I guess I did and I didn't mean to. I was trying to get to the point was that The decision to be closing these buildings has not been delegated to our department heads. It's a leadership decision, and we're all in compliance with that. And the department heads are defining essential services as best they can and complying with the mandates as best as you can articulate them.
That's correct, sir.
Thank you very much. I had an epiphany, not an epiphany, but it was just coming to understand that we're actually going to close the county services. A tough one for me to get my head around. And talking with my staff this morning, it just, I guess that's where we're at, and we need to flatten that curve, and I think the impacts to our county are going to be dramatic. And so I'm very much interested in primarily protecting the public, making sure that we're compliant with what we need to be doing in order to ensure that safety, and so I'm on board. Thank you very much. I appreciate it, and I'm going to second that motion that was made by Supervisor Couch. Thank you, Madam Chair.
Thank you, Supervisor Gleason. Ryan, I see you punched in again.
Yeah, I appreciate it, Madam Chairwoman. It was a while. I can't quite remember, but I will take the opportunity to thank the board for your leadership, your support during this really kind of extraordinary time. It's a really uncharted waters, but we are approaching this with, trying to approach this with common sense, with calmness, and trying to make smart decisions. I want to our employees, thank our employees for their continued support and their cooperation during this time. I want to let them know that they don't have to worry about a paycheck. They will wake up in a couple of weeks on a morning, their check will be in their bank account and their benefits will be paid, and that's great. We have people in our community who are going to be struggling, that aren't lucky enough to have jobs where they have got a guaranteed paycheck. Restaurants, bars, a lot of those folks are just getting by. There are very, very few of these places, service-oriented places with wait staff, bartenders, et cetera, that have the ability to sustain a weeks-long closure, certainly a significant downturn in their business. So I would ask that our community have an appreciation for those in our service industry who are going to be impacted the most by this. Think about wait staff at restaurants. Think about the janitors at the restaurants. Think about those who are running these places and these bars. Please, I would urge our community members to go pick up some food. Go out and grab some food and bring it home during this time. Support our local restaurants. They will be immediately impacted. They are worried about keeping the doors open long-term. They are worried about where their next paycheck's going to come from, keeping their workers paid, et cetera. I'd like our community to keep those people in mind as we go forward. Thank you.
Thank you. Supervisor Scrivener, and then Mick will be back to you.
Thank you, Madam Chair. Ryan, those are great comments, and we share those sentiments. The effect on our local community, it's going to be far-reaching and profound. You know, with this crisis coupled with what's happening with the oil industry, Kern County is going to be hurting for a while, and so we all need to be mindful of that. I also want to thank you and your staff and Mr. Constantine, all of our department heads, all of our employees that have done such an amazing job up to this point in addressing this situation. If the public wants up-to-date information from the county's perspective, they go to kerncounty.com, and that's spelled out, Kern County, county spelled out. I want to talk specifically about the upcoming board meetings. In speaking with our clerk of the board, I believe that the March 24th agenda is all on consent. Is that correct, Madam Clerk?
That is correct. We have reviewed what departments have submitted, and to date, all the items are on consent for March 24th.
Okay. So I would suggest that we combine the 24th and the 31st meeting to have it on the 31st. I think in the interest of limiting exposure as much as we can. So if we can consolidate the 24th and the 31st agenda to the 31st, if all the board members are agreeable to that. Once we get into the calendar after that, April 7th and the 14th, we are dark due to Easter break, spring break. And then I think that we reevaluate as we look at the meetings resuming on the 21st of April, the 28th, and so on, and see if we need to continue to try to combine agendas. And so I don't know, do we need a motion in order to do that, Madam Council, to combine the 24th and 31st agendas for the 31st of March?
I think that would be wise.
Okay, I'll make a motion to that. Can I add it to the motion that's on the table?
Certainly. I
We
accept
do
that.
have a motion and a second, so we can add that modification. The motion makers accept that?
Okay.
Modification, excellent,
And
thank you.
Thanks to all, and God bless.
Thank you, Supervisor Scrivener. Supervisor Gleason.
Thank you, Madam Chair, but we already hit on those points that I wanted to bring up again.
Thank you,
So,
Supervisor Gleason. Supervisor Maggard.
Thank you. Mr. Constantine, with regard to recycling centers, it seems to me that there are other activities in our community that easily spread this. So could you inquire of the state if we should do something about, I don't mean just putting recycling in our blue bin. I mean these centers in grocery store parking lots where people bring all this stuff, and should we think about closing those down? And can you give us some direction as we go forward about that?
Yes, sir, will do.
Thank you.
Thank you, Supervisor Maggard. Any other input from the public? Okay,
Madam
we have.
Chairwoman, if I may, I'm sorry to
Brian?
interrupt you. I just
No
wanted to
problem.
say that I wanted to confirm, because it was brought up about veterans services, all offices will be closed. All veteran services offices will be closed to the public. Services will be offered through phone appointments and interviews via the phone. Documents can be dropped off at the Bakersfield location.
Thank you, Mr. Alsup. We have a motion and a second with modifications. Please cast your votes.
The motion is approved. All ayes.
Thank you. Thank you for your swift action and leadership, Mr. Alsup. Moving along to item number 4 is public presentations. This portion of the meeting is reserved for persons to address the board on matters not on today's agenda, but under the jurisdiction of the Board of Supervisors. Mr. Moxley, we'll see you. Be safe out there. Thank you. Godspeed to you. Any members of the public? Seeing none, we're going to move to board member announcements or reports. Colleagues? Seeing none, we will move to adjournment. Oh, excuse me, I'm so sorry. We are moving to items 12 and 13 that will be heard concurrently but voted on separately. Behavioral Health and Recovery Services. Mr. Bill Walker's making his way forward. Proposed memorandum of understanding with Clinica Sierra Vista to provide medication-assisted treatment services at community health centers from March 17 through June 30, 2021. And then, excuse me, item 13 is a proposed memorandum of understanding with Omni Family Health to provide medication-assisted treatment services at community health centers from March 17, 2020 through June 30, 2021. Bill, the floor is yours.
Thank you, Madam Chair, and good morning, members of the board, CAO. As was stated today, item 12 and 13, both which refer to medicated assisted treatment, or MAT, as is commonly referred. When we first took this off consent, because this is not controversial, because we wanted to present to the board and to the public what our department is doing to enhance opioid services. And it seems like in the 2 short weeks since we took it off consent, it's been dwarfed by what we're dealing with today. But it's important for the public to know where we're going with our services for opioid addiction. And Kern BHRS staff and representatives from AMI and Clinica Sierra Vista were going to be with me so that you would actually meet the medical professionals that are stepping forward and meet our service delivery system. So unfortunately, today you get me. I've given you a handout of a PowerPoint from a presentation we did for the faith communities and the state legislative leaders. And on the third to last page, there is a page that says Substance Use Disorders Opioid Response Plan. And I'm giving this to you so you can see, one, where we stand currently with our opioid response, but specifically the difference between NTP and MAT. Narcotics treatment programs is the long-standing methadone programs that people hear about. Aegis and American Health are the two in our county. And we currently support those programs to the tune of over $12 million of services coming out of our budget directly to pay for those services. And if you notice as you look at that handout, that this is a daily dosing program. I know Supervisor Maggart through the chair, you've talked to me about this program, you've driven by it, and you'll see people standing out front waiting to go in to get their dosing. When you get over to the medicated assisted treatment, this is a prescription versus a daily dosing. And there's a lot of people in their addictions, especially younger people whose addictions have gone through pain medications, do better with a prescription, which also allows them to work more readily. But there's a fiscal impact to the county that's radically different, is that the cost of MAT is actually funded through physical health care. The cost of NTP is funded through our realignment dollars, which you know are quite limited. So $12 million of county realignment dollars are paying for this side. Federal and state dollars for medical services pays for this side. Now with that optic and the fact that this can be a prescription that people's lifestyle could be less interrupted if they're doing MAT, I'm now going to go back to the actual board request. Behavioral Health and Recovery Services, BHRS, requests the approval of a memorandum of understandings with Clinica Sierra Vista and Omni Family Health for substance use disorder medication assisted treatment, MAT, services at community health centers. There is no fiscal impact associated with this agreement, but I would add, as more people are on MAT, our dollars to provide services to the substance abusing individuals on the streets, there will be more free up dollars to provide those services. Buprenorphine, brand name Suboxone, is a drug used to treat narcotic opioid addiction that contains a combination of buprenorphine and naloxone. Buprenorphine is an opiate medication, while naloxone blocks the effects of the opioid medication. Clinica and Omni provide these treatments in select primary care clinics, so they're going to their medical doctor with individuals with opioid use disorders in order to facilitate access to this evidence-based treatment. So we are training the medical doctors to be able to provide all of their medical care and this care within those clinics. In the fourth paragraph of the board letter, it says, this MOU establishes a bi-directional referral system whereby Clinica or Omni will direct their MAT patients to additional specialty substance abuse services through Kern BHRS. BHRS will refer individuals receiving substance use disorder treatment services to select Clinica and Omni sites if they have a need for MAT. So what we're getting out of this is just phenomenal, is that as MAT becomes available in the medical clinics, our patients can get their services of MAT and their medical services, and they can be referred for additional outpatient or residential services through us. If someone comes to us and they need this medical service, we're now allowed to get them into this through one of the local providers, through Clinica and Omni. And so if it wasn't for what we're going through today, I would say this is the biggest thing you would hear today, but now it's literally dwarfed. I would like to also say that under the essential services, Kern BHRS is maintaining all of our crisis systems, our mobile evaluation teams, our hospital contracts, our PEC CSU, our 24/7 hotline. All of them and our access to assessment. All of these have been modified to be as safe as possible for the staff. As for our routine outpatient services, they are routine, but they are vital. It's the only place where some individuals see a psychiatrist and get the prescriptions. We have reduced our clinics all across the county to a skeleton crews to maintain the vital services and eliminate things like group therapy and things that put people together. We've also worked with DHCS to allow us to write prescriptions for longer amounts of time so that if someone is stable on their medication, they're not having to come back to the clinic as frequently as before. I know I went off script there, so to finish my presentation on Matt, this memorandum of understanding has been approved as to form by the Office of County Counsel. Therefore, it is recommended that your board approve the attached memorandum of understandings with Clinica Sierra Vista and Omni Family Health to provide medicated assisted treatment services at their clinics. And I am available to answer questions.
Bill, thank you. As you can see, folks are being cautious today.
Yes.
Which is a good thing. I appreciate your expertise. Are there members of the public that would like to weigh in or ask a question or direct it to staff? Seeing none, I will return to my colleagues for comment, question, or action on item number 12.
Motion to approve.
Second.
We have a motion and a second. Please cast your votes.
The motion is approved, all ayes.
Okay, and we've heard item 13, but now as to item 13, colleagues, or rather any members of the public who would like to weigh in on item 13? Seeing no interest, I would ask my colleagues for action.
Motion to approve.
Second.
The motion is approved, all ayes.
Okay, thank you, Bill. I know you'll keep us abreast. This brings us to the end of our morning agenda. We are going to adjourn to closed session, and we'll be back at 2, but now I'll entertain a motion for adjournment. Without objection, so ordered. Thank you, Mick.